Your balance, your sense of balance is a complex thing. Your balance centers in the brain receive input from your inner ear balance system, but also from your joint sense and your vision. Your inner ear is telling the brain if you're moving, in what direction, at what speed. Your joint sensation, notably your neck, is telling you where your head is in position. And your ankles are telling you whether or not your ground is level. And also you've got your visual input saying that this is where you are within your surroundings. So your sense of balance is a combination of these things coming together. And any mismatch that you have between these will lead you to feeling off balance. Obviously, your ears are giving you information regarding position of your head in space, as well as rotation, as well as linear motion, acceleration, and the input of the ears of the three things is probably the most important for a good sense of balance. Based upon my comments regarding the balance of the input from the inner ear and the combination three systems, anything that affects these components, either the vestibular system, your eyesight or joint sense, can affect balance. Additionally, imbalance can also be caused by disorders out with these typical areas. For example, if we look at the cardiovascular system, people with low blood pressure or people who, when they stand up very quickly, when they've got poor blood pressure control, particularly in the elderly, will tend to feel very lightheaded. And again, it's quite different from somebody who's got an inner ear type problem. As well as your cardiovascular system, you also get problems with your neurological system. You could have a peripheral neuropathy where you've got loss of sensations, you're not sure where your limbs are, or also weakness and unable to support yourself. You also have got to include, of course, central disorders, which includes disease affecting the brain function, is something severe as a stroke or something like MS and so forth. You also have your medication you could be on for a long term, and some of these can have a notable side effect causing imbalance. So you can see that imbalance itself has got a complex area and extends beyond your inner ear function itself. And I think our role in ENT is to identify the ENT causes, but to also be aware of the other potential causes of imbalance that need to be eliminated. Okay, well, I think now I'd like to maybe focus more on your typical ENT causes and not necessarily drawn into the wider spectrum of imbalance as we previously discussed. In the typical adult population, when I see at my clinic, there are 5 notable causes of vertigo. And in order of frequency of occurrence, these are 1, BPPV. That stands for benign paroxysmal positional vertigo. And this is a very simple situation where there's some loose debris floating around inside your inner ear. It gets trapped. That means when you move to one direction, the debris will come along and stimulate a sense of imbalance. It's typically short-lasting. It's very positional, so it's often when you look up, or you're stooping down, or you're turning to one side in the bed. This is very easily diagnosed and treated. The second most common one I see, ironically, is not an inner ear problem. It's something called migraine vertigo. This is surprisingly common, probably affects 1/3 at least of the patients I see at a typical vertigo clinic. The thing it causes confusion for people is that headache is actually very rarely a feature of this. So people do misinterpret the signs. Migraine vertigo is very variable in its presentation, but when suspected, there are treatment options available that can lead to improvement in the symptoms. Thirdly, and back into an ENT problem, is a condition called acute vestibular neuronitis. This is typified by acute onset of rotatory vertigo, and it often follows somebody who's been run down, had a flu-like illness or a heavy head cold or something like that. The key element here is there's no change in hearing. Typically, the peak of the symptoms lasts for a few hours, a day or two, but it can take quite a while to recover. And about 1/3 of patients with this will actually end up having BPPV as a secondary problem. Acute vestibular neuritis is simply managed and treated with expectation of improvement, also some rehabilitation exercises we can discuss later. Fourth cause is labyrinthitis, which is actually very, very similar to vestibular neuritis. And it's what you'll be told, oh, you've got labyrinthitis, but in fact, it's a relatively specific condition, very similar to vestibular neuritis, but quite rare. It's far more severe. You'll be a lot more dizzy, a lot more nauseated, it'll last a lot longer. But key point here is you also have a hearing loss with that condition in the one ear. Your final sort of, if you want a common cause, although it's very rare, is something called Meniere's disease. You may have heard of that. In fact, many people may have told you they've got Meniere's disease when they actually don't have. It's typified by isolated events where you have hearing loss, tinnitus, which is a noise in the ear, and vertigo. And these things come together. They last for a few hours to a few days, but between events actually return to near normality. Sometimes the hearing will slowly and insidiously go down, but for clarity of diagnosis, evidence really is sought by us by seeing you more than one occasion with repeat hearing tests, just see evidence of that fluctuation and allow us to establish that diagnosis and manage it appropriately. In general, so having gone through all the inner ear causes of balance, it's clear there's no real underlying weakness. People with BPPV, which are the commonest cause, that's the loose debris. It's associated in some people with a low vitamin D level, just by not securing that little bit of calcium securely in the inner ear, but quite frequently follows head injury. So people get a previous history to a blow to the head or a bang to the head. You sometimes think, well, BPPVs may well be the cause. The other sort of causes we discussed, the ENT ones, your neuronitis, your labyrinthitis, your Meniere's, are really and truly, it's a simple misfortune to develop these. Migraine vertigo, however, usually develops in people who have had prior migraine history and maybe it's triggered by stress or hormonal fluctuations through menopause that brings it on at a later time in life. Balance disorders themselves, when you take away true vertigo, in general are more likely in certain subgroups, typically the elderly, due to our potential cause of imbalance related to the sort of issues that are separate from inner ear issues, e.g. postural hypertension. That's where when you stand up you feel quite lightheaded. When you get older, you're unable to get that blood pumped back to the heart rapidly enough to support the blood getting to the brain. They have more wear and tear of their joints, especially lower limbs and their neck. They often have reduced vision as well with early cataract formation. They're often multi-medications, and these will often interact or cause side effects and make them feel dizzy. So when getting older, it's expected balance will not be as sharp as it once was. And the approach often is more directed towards eliminating common causes and ensuring everything else is working as best as possible. This usually is less inside the remit of an ENT surgeon, and usually we get input from care of the elderly in these sorts of circumstances. Other people with chronic illnesses, for example, the diabetic patients, if they've got poor control, they may have poor balance, either through acutely, with the blood sugars going up and down and making them feel quite unsteady from that alone. Whereas if you've had chronic diabetes, particularly poorly controlled, you can end up with peripheral neuropathy, very subtle, but you may lose that good sensation of where you are on the ground. So there's a whole host of other reasons that may cause imbalance beyond simply inner ear problems. I think we covered that in some ways in the last question, but certainly in the fit and healthy, an acute vertiginous episode is normally out with your control. There's not a lot you can do to stop it from happening. Obviously, in those with underlying health issues, where there may be other reasons for you being unsteady or dizzy, you really need to make sure your condition is managed as best as possible to minimise any complication of the disease or even from the medication prescribed.